All right, let's get ready to crack the code of some vital health clues, shall we?
Sounds intriguing.
Today, we're taking a deep dive into the world of vital signs.
Ah, those essential measurements.
You got it. Those readings that can tell us so much about what's going on inside the body. And we're going way beyond the basics here.
Oh.
Yep. We're using some awesome insights from Nurse in the Making's YouTube channel.
Oh, I've seen those videos. They're great.
Right. You're going to learn some really cool stuff, like, get this, why athletes have ridiculously low heart rates.
Fascinating. The human body is truly amazing.
Oh, and we'll also tackle how even a normal low oxygen level could actually be a red flag. There's so much more to these readings than meets the eye.
Absolutely.
Yeah.
It's incredible how much we can learn from just a few simple measurements.
Right. It's like they're whispering secrets about our health. So let's kick things off with the pulse, that rhythmic beat we feel.
Oh, in our wrists and necks, right?
Yeah, exactly. It's all about how hard our heart is working to pump that blood throughout the body.
The engine that keeps us going.
Totally. And it's measured in beats per minute. I used to think 60 to 100 beats per minute was like the magic number for everyone. But then I heard about these athletes with resting heart rates down in the 40s.
Wow. That's pretty incredible.
Right. Like, how is that even possible?
It's a testament to how adaptable the human body truly is. For athletes, it's not about the number of beats, but more about how much blood their heart pumps with each beat.
So it's like their heart is super efficient.
Precisely. Think of it this way. Their heart is a high-performance engine, delivering a larger volume of blood with each powerful stroke. It's not just about speed, it's about efficiency.
Okay, so it's not just about how fast, but how much. That makes sense. So let's say we want to check someone's pulse. What's the best way to go about it? I've always just used my thumb. Is that all right?
Well, actually, it's best to avoid using your thumb.
Oh, really? Why is that?
It has its own pulse, you see. So using your thumb can sometimes give you a misleading reading. It's much better to use your index and middle fingers. You just gently press on the artery.
Got it. So no thumbs, two fingers it is.
Exactly. And you're not just checking the rate, but also feeling for the strength of the pulse.
Oh, so it's not just about how fast, but how strong, too.
Exactly. That can tell you a lot about a person's circulation.
Okay, so pulse strength is a clue. Got it. And what about that 30-second shortcut I've heard about? Can we always rely on that?
It's a good starting point, for sure, especially if the pulse is regular. But sometimes you need to be a bit more thorough. Imagine you're a detective listening for clues. Sometimes those little irregularities, the things you might miss in 30 seconds, are the key to solving the case.
So we're looking for those subtle hints.
Exactly. So if there's any concern at all, a full minute count gives you a much more complete picture. It's like taking the time to really listen to what the body is trying to tell you.
Makes sense. It's better to be safe than sorry. Speaking of detective work, what about those Doppler devices I always see in hospitals? What are those all about?
Ah, yes. Dopplers are like super sensitive microphones for your blood flow.
Oh, wow. So like they can pick up those really faint pulses.
Exactly. They use sound waves to detect those pulses that might be too difficult to feel by hand. They're incredibly helpful when someone has weak circulation.
So they're like giving those heartbeats a megaphone. That's pretty amazing. Okay, now let's move on to the locations we can find those pulses. We've got radial, apical, and carotid. Let's break those down.
Sure. The radial pulse, that's one on your wrist, is the most common and the easiest to find. It's usually the go-to spot for a quick check.
Yeah, that's the one I use most often. What about the apical pulse?
That one's a bit different. You measure it directly over the heart with a stethoscope.
Okay, so you need a stethoscope for that one.
Exactly. And it gives you the most accurate reading of the heart's rhythm. Then there's the carotid pulse.
That's the one on the side of the neck, right?
Yes, that's right. It's an important one, but you got to be a bit more cautious with this one.
Yeah, that one always makes me a little nervous. Is there anything specific we need to keep in mind when checking the carotid pulse?
Absolutely. First off, you only want to check one side at a time.
Okay, one side at a time.
And you want to be very gentle. Remember, you're feeling for a pulse in a major artery that supplies blood to the brain. Too much pressure there could temporarily reduce blood flow.
Whoa, okay, noted. One side at a time and a light touch. Got it. Now let's move on to respiratory rate. That's the rhythm of our breath. What's considered normal here, and why is it so important?
Well, each breath we take is all about bringing in oxygen and getting rid of carbon dioxide.
That gas exchange, right?
Yes. It's what keeps our cells alive and kicking. A typical adult breathes somewhere between 12 and 20 times per minute at rest.
Now, I remember reading somewhere that checking respiratory rate is all about being sneaky.
Oh, you mean like a ninja in the night?
Exactly. You want to count those breaths without the person even knowing. Why is that so important?
Well, think about it. If someone knows you're counting their breaths, they might unconsciously change their breathing pattern.
Ah, so it's like observing wildlife. You want to see their natural behavior.
Exactly. So you want to be subtle about it, maybe check their pulse,
Mm.
or pretend to adjust their pillow while you're discreetly counting those breaths.
Okay, so we're aiming for stealth mode here. Got it. But wouldn't the patient's comfort level also play a role in how they're breathing? Like if they're anxious or in pain?
Absolutely. Think about how your own breathing changes when you're feeling stressed. That's why it's so important to give the patient a few minutes to settle in and relax before you take that measurement.
Makes sense. You want to get the most accurate reading possible. Okay, next up, oxygen saturation. That's the percentage we see on the pulse oximeter. What does that number actually tell us?
It's like checking the fuel gauge for your body's oxygen supply. It tells us how much of the hemoglobin in your red blood cells is saturated with oxygen. Hemoglobin acts like tiny delivery trucks, picking up oxygen from the lungs and delivering it to all the tissues and organs that need it.
Wow, so it's like a vital supply chain. And what's the expected range for a healthy person?
Ideally, we like to see that number between 95% and 100%. Anything below 95% means the body might not be getting enough oxygen, and that could be a sign of trouble brewing.
Now, you mentioned something earlier about COPD patients and how their normal oxygen levels might be a bit different. Can you explain that a little more?
Right. For folks with chronic obstructive pulmonary disease, their lungs aren't as efficient at absorbing oxygen. That's because of damage to the lungs. So their baseline oxygen saturation might be a bit lower, even in the 88% to 92% range. It's like their delivery trucks are working with a smaller sleet.
So they're still functioning, but maybe not at full capacity.
Exactly. And this is crucial for healthcare providers to know. They wouldn't want to treat someone with COPD based on the normal standards that might not apply to them.
So it's all about understanding the individual and what's normal for them. That makes a lot of sense. And speaking of individual factors, have you ever noticed how sometimes those pulse oximeters just don't want to cooperate?
Oh, I know exactly what you mean.
Like sometimes I feel like I'm doing something wrong, but it just won't give me a reading.
It can be tricky sometimes. Things like cold hands, poor circulation, even artificial nails or nail polish can really throw off the readings.
What, really? Even nail polish?
Yep. It's like trying to shine a light through a thick wall. Sometimes that signal just can't get through.
So it's like the pulse oximeter is trying to send a signal, but sometimes those signals get lost in translation.